Hello everyone. So today we are going to discuss a gastrointestinal question. So we have a 17-year-old boy presented to the office due to pain with swallowing, so dysphagia, or dinophagia, rather you can say, which is pain with swallowing. He also complains of sometimes food not going down. So in other words, you can also say the question can say food getting stuck in the esophagus. He has no other significant medical history except for allergic rhinitis, for which the patient is using intranasal steroids. So the patient has some allergy history. Family history is significant for grandfather with esophageal cancer. Vitally, the patient is stable. Physical examination is normal except for allergic shiners, which is just the allergic rhinitis, one of the features, the dark circles that form under the eyes. So that's allergic shiners. Upper GI endoscopy shows ringed appearance of esophagus, and biopsy shows 25 eosinophils per high power field. What is the next best step in management? So the ringed appearance of the esophagus is also called trachealization of the esophagus. Key points in the question are sometimes food not going down, so that's food getting stuck in the esophagus. Allergic rhinitis history, some allergy history. Other is the appearance of a ringed esophagus or trachealization of the esophagus. And another key point is the biopsy finding of 42 eosinophils per high power field in the esophagus. All of these clues, a lot of clues, point to eosinophilic esophagitis. So patients are often have family or personal history of some other atopy as well. They can give you eczema easily in the question instead of allergic rhinitis, for example. Ringed appearance of the esophagus or trachealization can occur. So eosinophilic esophagitis is the answer. You will have dysphagia or dinophagia or food getting stuck, those symptoms. For diagnosis, you can do endoscopy, also biopsy. What's diagnostic on biopsy is seeing eosinophils that are greater than 15 per high power field. Here, they're 42, so it is eosinophilic esophagitis. Management is PPIs, topical steroids, and elimination diet. This is the treatment. Now, let's go one by one because they are asking, the question is next step, which is a classic step 2 question. So the next step, the answer is E. Avoid certain foods in diet. There are certain proteins that should be avoided in diet. So what you are gonna tell the patient is that if you are experiencing symptoms with a particular food, especially these are like proteins, then you should avoid those proteins. It's simple as that. If that is not helping, you can use topical steroids. These are usually aerosolized steroids, and also you can use PPIs. PPIs sometimes help, sometimes they don't. Albendazole is wrong answer. A. That is going to be for if you are suspecting a parasite infection or helminth infection, which can cause abdominal pain and those other features, but they're not going to cause eosinophilic esophagitis or ringed appearance of the esophagus. So A, wrong answer. B is praziquantel, again, wrong answer. This is again for helminth infections. Again, cyclovir is wrong answer. This is for CMV infections. CMV typically cause infections in HIV patients or those who are on immunosuppressant medications, CD4 count less than 50, usually cause retinitis, a blurred vision, CMV retinitis, colitis, and also esophagitis. But eosinophils are not going to be seen. Ringed appearance is not going to be seen. You're going to see linear pattern, linear ulcers on endoscopy, which are not seen in this patient. Acyclovir, wrong answer. That will be HSV can cause esophagitis, but on endoscopy, you are going to see punched out ulcers. Wrong answer. Fluconazole is wrong answer. Candida can cause odynophagia and dysphagia, but Candida esophagitis will have white lesions or white deposits on the esophagus. Wrong answer. Reassurance is wrong answer. So this is just a summary table of different causes of esophagitis. Some microbes that can cause esophagitis, for example, Candida. Candida esophagitis on endoscopy, you will see white lesions, and treatment is fluconazole, antifungal. CMV can cause linear ulcers, and on endoscopy, they will say there are lines, there are linear ulcers, and treatment is ganciclovir for CMV. Remember, the CD4 count for CMV is less than 50. For Candida, it's less than 100. Herpes can cause esophagitis as well, painful swallowing, but on endoscopy, you're going to see punched out ulcers.